really all in their stuff, like heels and shit. I'm like, are you fucking kidding me? You're coming to a gym.
Hold on. Let me make sure I'm. I'm not like.
Okay, I show that it's 8:30 and I'm going to call the Humboldt County Board of Health meeting to order. First thing we'll do is the Pledge of Allegiance. Please join me at the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next item on our agenda will be public comment. If you would like to make a public comment, now's the time to do so. Please state your name for the record. Mendel? Come on up.
Rendell Miller, for the record. So I don't think it's much of a surprise. I'm not in favor of masks. I don't want to go backwards in time. I don't want to see closures. I want to talk about choices regarding rights and consequences first. I have the right to have a firearm, and I can choose to own or not to own one. Someone comes into my home, to harm me, I can choose to use that firearm, or I can choose not to. However, I must live with the consequences of my actions, whichever way I go. If I kill somebody, I'm going to have legal consequences, along with economic, social, personal consequences. If I do nothing to stop the intruder, maybe he only wants my money and everything's done and he leaves. Or maybe I'm dead. I don't know. But I got to live with the consequence, whichever way I go. I have the right to vote. I have the right not to vote. I have to live with whatever the outcome is. If I have a say in it, at least I can feel like I did something. More important to this issue, I have the constitutional right to make choices about my body and my life. I have the right to get vaccinated or not. It's really where this is going. I have the right to live with the outcome. This is not a case where the state should be involved. This is my choice. Whether I get vaccinated or not, I live with the consequence. afterwards. If I get sick, I get sick. That's the natural consequence. If I get vaccinated, maybe I get sick, maybe I don't. I live with the consequences. I have the right to wear a mask or not wear a mask. Just like I have the choice whether I want to wear shorts in wintertime or jeans in wintertime. Maybe one's not smarter, maybe it is. Doesn't matter. It's my choice I get to make. The state needs to let me decide rather than interfering with my free liberties, and let me make my choices on what I want to do. In any of these circumstances I listed, I must live with the outcome, as we all must. But attempting to impose your will on me, I won't bow. I didn't wear the mask. I didn't adhere to this mask mandate. I didn't do it all the way through this whole pandemic. We can move on and we can do things smartly, but it's all of our choices what we do. Let it be our choice.
Thank you. Arnie, come on up. State your name. For the
My name's Lauren Lyon. I'm not sure if you guys know what a nanomicron is. Okay, the nanomicrons is how you measure any virus or anything like that. COVID-19's nanomicron is 0.06 to 1.4 nanomicrons.
Lauren?
Lauren, can you move that microphone closer to your mouth?
Oh, okay.
Thank you.
Okay, COVID-19 nanomicron size is 0.06 to 1.4 nanomicrons, depending on how much the cluster is. Now, the M95 and HEPA filters are the only thing that they say will stop it. Their nanomicron is 10 nanomicrons. Okay, way filters work are, well, let me restate this. I was trained in the Marine Corps as NBC, NCOIC, that's nuclear, biological, and chemical non-commissioned officer in charge. I had to know all the filters and how they worked. The way a filter works, it's like taking Swiss cheese and cutting slices off of it. Then you randomly mix them slices up and try to get where none of the nanomicrons will go through all the holes at one time. They'll stop in the other slices. So even though the M95 is a layered mask, it can still fail. Any mask can fail. Now everybody around town is wearing cloth mask. Cloth mask is 2.5 microns. That is 25 nanomicrons. So that just goes right through a cloth mask. Like it's not even there, even if you double layer it. So what you're mandating would be inadequate thing if you decide to mandate it. Plus, I believe, like Attorney Miller said, it's against my rights. I have the right to believe what I believe. I believe in God. God put me on this earth. I don't have to wear a mask if God says, because what God says, my health is his concerns. So you'd be violating my constitutional rights by mandating a mask. Plus, you put yourselves liable for a constitutional lawsuit for violating my rights. Okay, that's all I have. Thank you.
Thank you, Lauren. Come on up.
My name's Kevin Chatfield, and my thoughts on all this are, if you want to wear it, wear it. You want to get the shot, thank God it's available. If you don't have to. Mandating things in history has never worked, and it's not going to work in this case. It's almost like we're out of control because we don't know what to do. The bottom line is, thousands of people die from smoking, alcoholism, car accidents. Are we mandating they don't drive anymore? They don't smoke anymore? No. So this whole premise is an individual choice. And I truly believe that's the way it should be. It's the way God intended it to be. You make your own choices. Nobody else can make them for you. The only thing we look to the government for is to provide us with a safe place to live and protection from those who would try to take that away. But mandating masks is just insanity as far as I'm concerned. But I know you guys will make, and gals will make the right decision. Thanks.
Thank you.
Hi, Michelle Miller for the record. I just want to I looked up a couple statistics today. So the vaccination rate in Humboldt County is 32.48%. I'd like this commission to keep in mind that they don't just represent that 33%, they represent the other 67% as well in Humboldt County. Where we at with COVID today is not where we were before. This is not August of 2020, this is August of 2021. We have information readily available, allowing people to make their own choice about their own health. We have information about vaccines, death rates, treatments, who's most likely to get the virus, and yet we're still all making our choice. And with all that information, you still have a vaccination rate of 32.48% in this county. People understand these risks. They understand the consequences of their choices. Government is basically stating to us when they do these mandates, we don't like your choice. So instead of allowing you to make choices, we're going to mandate your choice. We're going to force you into the choice we want you to make. I think that that's gross misconduct on behalf of our government. I hold here in my hand, this is a resolution that this commission passed in February of 2021. And it has to do with COVID restrictions, shutting down businesses. There are resolutions that I've highlighted that you made, and I'm happy to give this back to any one of you that doesn't remember what you passed. You said that you weren't going to shut our businesses down. You weren't going to provide us with more restrictions. You weren't going to mandate us back into compliance. It also says you weren't going to agree with Governor Sisolak in these areas. What's before you today is a mandate not only of masks, but of closing down large events. So this commission is actually looking at not only going along, once again, locking step with Governor Sisolak, it's looking at going further and beyond what Governor Sisolak's even recommending by closing down our events. This is going to be tragic for all of our local businesses. I'm a local business owner, and I know many of the people here are. When you start doing that, we start losing business. We start having fights at our front door about who can come in with masks and who can't come in with masks. We once again have our local PD and Sheriff's Department coming to these kinds of events. Enough is enough. Let us make our own choices. Let us live our own lives. Let us understand the consequences of our own actions, and just let us be. Thank you.
Thank you, Michelle.
Good morning, Jill Chatfield. I'm sitting there trying to collect my thoughts, thinking what I want to say, and I find it rather ironic that you all are going to make a determination over mask mandates, and with the exception of Wendy, none of you are wearing masks. So that kind of tells me how you feel about masks. The bottom line is, I understand you're looking at making a decision for the public health. I'm here to tell you, I'm the public. I want to make my own decision. And that's all I have to say.
Thank you, Jill.
Hi, my name's Deborah Gay. I had a big thing I was gonna talk to you guys all about, but one thing I wanted to say is Michelle said something about 32% of the people are vaccinated. The reason I see that people are not being vaccinated is because a lot of people have information. The VAERS data says that from the vaccination itself, 9,571 people died from just being vaccinated. The adverse reactions are 480,700 adverse reaction, people with paralyzing events. And they're going to get to a point to where they're going to try to mandate the jobs in these businesses before people can go to work. This is sad that our government and our people have to go through this. It is our choice to whether we want to be vaccinated. And I'm telling you now, I would rather die than get this vaccination because I don't want one of these things happening to me. Death, adverse reactions, and it's like a crapshoot. Who's going to get the sickness from it? We all have to think really hard. God gave us an immune system to fight off immunities. We have to get back to God and what he chooses us to do, not what people want us to do. Thank you.
Thank you. Anyone else? Jill?
Jill Stepper for the record. You know, I just want to sit here and kind of come at it at a different angle. You know, the mask mandates, we don't agree with. You're well aware of all that. However, I believe in the Constitution. The Constitution has given us the right to stop the government from overstepping and overreaching. This government that we currently have has been overreaching, stepping on everyone. It's our will as the people, and it's your job to fight for us at this level. I know that the governor's been giving you a lot of grief and you're getting a lot of heat from it, but you know what? It has caused a divide in our communities. It's caused division between family, friends, neighbors, co-workers, employees, employers. Everybody has been divided by what this government is mandating, and it's just wrong. It's our job and it's your job to fight against the bigger power that's causing all of this. We need to stop it at a local level, and we need to tell the governor this is not working and it's not going to happen. And we need your help to do this. We will help. We're all standing behind you, but we will fight with you against this government. But we need to make the changes because it's causing division and it's causing hate and discontent everywhere. So that's all I had to say. Thank you.
One else? One up?
My name is Ella Height. I basically am going to reiterate what many of the other ones have already stated. The masks do no good. The vaccines are just as apt to kill you as they are to save you. So if I'm going to take 50-50 odds, I'm going to go against the vaccine. Masks make you breathe in the same toxic air that your body is exhaling, which is also going to cause you problems. I personally can almost not breathe at all. If I put a mask on, I have to keep, even like when I'm working with moldy hay with my livestock, I have to keep walking away from the hay and pulling the mask off because the mold makes me almost choke to death. So I have to walk away from the hay, pull the mask off so as I can get a breath because I can't breathe through the mask because it suffocates me, because I have problems. I've already had the COVID, and I'm telling you, it can be dangerous for people like me because I've got an autoimmune disease. I've got severe lung damage from years of both chemical burns and pneumonia, and also infection in my lungs. I've had a heart attack, and I'm over 65. I don't have the odds in my favor, but I survived it. I didn't know if I was going to, but I did. And I'll take a chance on it again before I'll get the shot. Because it's wrong, it's unconstitutional, it's immoral, and it's anytime they have to bribe you to get you to do something, you know there's something the matter with it. Stand up for we the people. Stand up for our God-given rights and our Constitution, and tell Sisolak and all his cronies where to put their vaccine and their masks. Thank you very much, gentlemen and ladies.
Hi, I'm Kat Hall.
When this all started, I did a lot of reading and researching on mask efficacy, even under the CDC's website, and all of it showed no efficacy in wearing masks. Yet we continue to push this agenda, have our kids wear masks during school. And now, after many months of everybody walking around with no masks, kids playing with each other, now that school's starting, and what I believe the teachers union is very one-sided politically, now it's a rush to get masks on everybody again. This is a pretty obvious political agenda as far as I'm concerned. I also am very unclear as to why we are heeding the advice of highly paid government officials that had a hand in funding and creating this man-made variant to unleash on the world. So I, for one, will not take advice from Dr. Fauci or anybody of his sort. And no doctor is going to tell me how I can control my health and my children's health. So that's definitely how I feel about the mask. And I'm very unclear as to why everybody doesn't see what's happening here. I think it's criminal, absolutely criminal. If anybody in this county mandates masks for our children, for me, for our businesses. I know the vaccinations are a whole different story. And just for the record, if anybody wants information that I know is censored, that I receive and I read and I believe over the people that are being paid to push this rhetoric. Many stories. So please stand up for us.
Thank you. Do we have anyone else?
John Matthew Ortho.
Speak up into the microphone.
John Matthew Ortho, for the record. I have a quick background. I have a Bachelor of Science in Technology and Globalization, an emphasis in security, a minor in environmental security and international management. Professors were all active and non-active CIA. A degree for a one world government. Everything going on is not in our best interest. We shouldn't even be here. We've already gone through this. My body, my choice. Or does that only apply to killing unborn babies?
Thank you. Do you have anybody else?
Good morning.
Good morning.
Shelley Kylo. I'm just curious, when the Delta variant was first discovered in Humboldt County, what was the first case? What the date was? Because that's why we're here, right? Isn't this about the Delta variant? Why we're mandating masks again? Does anybody on this commission have that answer?
I don't have the answer, the date.
Because I know it was reported in June in Washoe County, and the first death was reported in July 1st in Washoe County. The statistics aren't, to my knowledge, aren't being kept in Humboldt County, yet here we are going to decide on a mask mandate. And also, I'm curious, is the virus now on hiatus? Because as being pointed out, with the exception of Ms. Maddox, nobody else up here has a mask on. And if this is such an emergency, why wasn't there an emergency meeting called and the mask mandate put in immediately? Because it does seem more of a control issue than a public health issue. Thank you.
Thank you. Anyone else? Do we have anybody online?
Mr. Chair, Dave Mendiola. So Dr. Stringham has an appointment that he has to be at 9:15.
Okay.
So if we could get him in, and we can continue on public comment, but I want to make sure we get him in here.
Okay. We do. We got one more here.
There'll be other opportunities. Hello, I'm Amber Ramirez for the record. I just have a few questions. We're supposed to be following Stringham's health advisory. I have not seen anywhere where he has advised or told the public how the Delta variant is tested. I personally believe that there's no Delta variant. If it's so deadly, why don't we know how to prevent that? And wearing masks, the Delta variant wasn't discovered until after wearing masks. So how is that effective today? Also, sorry, we're dividing our county more and more. Humboldt County has been home to me for the last 5 years, and I go out in public without a mask and I get, all these different looks, and we're just so divided as a community. Recently, there's been one woman, single mother, 5 children. She got into an accident. How is our community supposed to help people like her and within our community if we're so divided? I know that's a little off topic, but we can't come together as a community if we're divided. Thank you.
Okay, thank you. We will, I'm going to close the public comment for a moment here so Dr. Stringham can get on, and then we'll come back to that. So.
Just real quick. Lisa Werner, for the record. I was just thinking about how we all set. First of all, this is at 8:30 in the morning. This is a great group that showed up. There'd be more if it was at a time where more people could come. That's just I've just noticed there's more people this time than before. But, we stood and we said the Pledge of Allegiance. And part of that is, it says liberty for all. It's not liberty for some. Not liberty for this group, not liberty for over here, but it's liberty for all. So my thought is, if there's liberty for all, then that liberty should be that we have the liberty to make choices for ourselves and our family. And then the other day, I just wanted to share, I was talking to my 92-year-old stepdad. He said to me, I'm pretty sure I've fought in 2 wars. I'm sorry. He said, I'm sure I fought in 2 wars so we don't have to live like this. And I just want to reiterate that. For those of us that are young that have never lived through war and had to fight, he's fought in 2 so that we don't have to live like this. We're the free, we're the land of the free because of the brave. So let's be brave, you guys. Let's be brave.
Thank you, Lisa. Okay, we'll have another opportunity public comment at the end too. We're going to move to the county health officer update, Dr. Stringham. The floor is yours, doctor.
Good morning. Can everybody hear me? Is the sound quality okay?
Dr. Stringham, if you could speak up a little louder.
Okay. Is everybody able to hear me okay?
That's better.
Okay. How's the sound quality?
Yeah. We're good.
Okay, perfect. Oh, good morning, everybody. I have a lot of things I'd like to share this morning, and I think that some of my viewpoints, according to some of the comments that I've heard from the public this morning, may really kind of surprise you all. But I'd like to discuss basically 3 different things. First, I'd like to talk about the virus itself, about Delta virus, and I'd also like to talk about the convoluted mess that the American public is having to wade through with a lot of the different messages that have been delivered. And then I want to be able to talk about what I think is best, in my opinion, for Humboldt County. I know everybody has opinions about this, but I'd like to discuss what I think the best approach is for us all to take in moving forward. So Nicole Maher is here, and also Robin Dunkhorst from HGH. They're going to be talking about some of the specific numbers and also about what Humboldt General Hospital is going through and what the issues are as they see them. So I don't want to discuss any of those specifics. I have a lot of other things that I want to discuss as it is. So let's talk about a couple of things first. Most of us believe that our approach to a problem is the most important single factor in determining what's going to happen in the end. But what's more critical is to truly understand what the facts are. And in the case of this virus, it's to understand the capacities that this virus has, like the capacity to cause people to pass away. And that doesn't change if we use our influence to ignore the virus or to say that it's not real. To fight the safety recommendations, etc. And I think that, to me, to deny that hemlock can kill you doesn't change the fact that hemlock can kill you. And for those of us who do the right things, the outcome is determined, or those of us who choose not to do the right things, then the virus determines the outcome and not us. We can determine the outcome if we choose to do the right things. And to me, the bottom line is that if a person chooses not to do the right things, then you're correct. That absolutely is their option. And I think that we need to respect that. I do agree with that. I don't like to see that happen because I don't want to see people injured. But at the same time, I do believe that everybody has the right to make up their own minds. I do believe that, and I always have. The Delta variant, let's talk a little bit about the virus itself. The Delta variant has changed, and that's why our behavior is changing. That's why masks are being recommended once again. I think if I were angry about wearing a mask, I probably would look at the CDC recommendations and wonder why they keep changing recommendations. And if you were to ask me that question,
Hold up just a moment, please. I would ask all of you to let the doctor have his turn of speaking and be quiet. We're here to listen to him as well as you, so please keep your conversation to yourself until he's done. Thank you. Go ahead, doctor.
I just, folks, I feel compelled to tell you that I understand how you feel. I do. But at the same time, as a public health official, I want to be able to help protect people. But I am not going to take away anybody's rights. I don't support taking away anybody's rights. I'm an American first, and I'm a doctor second. And if people are wanting to not engage in doing what I see as being the right things, then I will fight for their rights to do what they want to do. I don't agree with it, but it's kind of the way it is. I'm hoping that each of you will allow me to give you some information that I promise is true. N95 masks do not just work as a mechanical barrier. They don't. They also have certain electrostatic forces that they create, and they cause viral particles to adhere to them. You may not believe that, but it's true. And the other thing is that a mask doesn't work as a physical barrier by not allowing viral particles to get through it. It also helps by slowing down the air and causing a tumbling, which causes the air that you breathe out to not go as far and not to affect other people as much. Is that perfect? No, but it's better than nothing. And you know, it's again, I'm not making this stuff up. I'm just telling you what the facts are as I understand them. The one thing I've learned through all of this is that everybody's entitled to their own opinion, and I understand that my opinion doesn't count any more than anybody else's, and that's fine. That's perfectly okay with me. I talked to Bryce Putnam, who is the county health officer in Elko County, and he shared with me some of the data that they're having over there, the fatalities, and I'm really concerned about that. My mission is to help protect people from that, but not if they don't want that protection. I do not have any interest in forcing my viewpoints on other people. And the bottom line is that if people don't want to take my recommendations, then don't take my recommendations if they're not right for you. Next, I'd like to talk a little bit about what I would call the convoluted mess, and that it's just all throughout the United States. We've got all kinds of different information that's coming at people, and it's causing the approach to be very confused. So I think that altered opinions and various opinions have just absolutely ripped Americans apart. I can see that, and I can hear that from some of the comments this morning. People are very, very angry. And but what I can tell you is that the virus absolutely is real. I wish it weren't, but it is. And but this is not about a virus. This is about something that's far more fundamental than that. It's about the oldest of all ethical questions, and that is the battle between our freedoms to do as we wish, our freedoms to live our lives as we want, pitted against our freedoms from, that other people don't want to be subjected to certain types of behaviors. And it's a very old argument in ethics, the most basic of all, freedoms to versus freedoms from. You could also say it's the rights of the individuals versus the rights of the group. And in our country, it's very clear where we stand on that. We celebrate the rights of the individual, and in certain cases, that hampers the rights of the group, and that's just the way it is. That's the way we chose to be. It's the way our Constitution is set up. In the United States, we hold these freedoms sacred. But people who are more compelled by the virus are appalled by what they see as being selfishness in those people who refuse to engage. And the people who are compelled by their individual rights are appalled by what they see as being extreme government overreach and erosion of their individual rights, the reasons that we live here in the United States and the reasons that we love the United States. So these two groups are not going to come together. They're absolutely not. We're not going to fix this rift that's being created. And the passions are too profound. When our campaign against COVID started last year in April, I thought I really understood what we needed to do. I thought I understood what I needed to do as a county health officer, and I thought this board needed to do certain things also. But what I didn't understand was the dynamics that would evolve and the anger that would develop as a result of this. And it's an absolute mess, and it's getting worse every day. What's critical at this point is to admit that this mess doesn't need to be fixed in order to address this problem. And so I think it's time for us to redefine what it is that we're really trying to do here. Let's start with mask mandates. For mask mandates, what I can tell you is, as a physician, my instincts are to protect other people from bad things that happen to them. I really want to be able to do that. And it's hard to have an intimate knowledge of what's likely to happen, but not to be able to act on that. And what I think is that the mandates only serve to strengthen people's anger and to further polarize us. It's political quicksand. And on the surface, mask mandates make sense. It's a great way to get everybody to do the right things, but it's a horrible idea. It's a superficial solution that waxes over what's really going on here, and it waxes over human nature itself, and it waxes over our laws, the ones that we have here in the United States that we've all agreed to abide by. People are angry, and even threats of mask mandates are intensifying their anger. Even if but here's the situation. Even if a mask mandate could get people to wear masks in public, which is debatable, it's not truly something that we are in a position to enforce, nor do I recommend that we do it. And the bottom line is that this virus spreads in private environments much more so than in public environments. We do not have the capacity or the desire. I don't want to go into people's houses and enforce anything like that. And so as a result, what this mask mandate would do is it would further polarize people and accomplish the exact opposite of what it is that we're trying to accomplish. So I'm going to say it publicly. I do not support mask mandates. I support safety. I support people wearing masks, but I don't support mandating that. I think it's absolutely the wrong decision here in Humboldt County.
Done.
I have a couple of other things I'd like to say.
It's been going since this thing started. right.
I said,
I've
and
read
recently
some.
Matt Gagan can be kicking and screaming.
Kicking to.
Do you know him? That's familiar.
No, I don't hear that.
He was back then.
Yeah.
Can everyone hear me?
We can't hear the commissioners meeting.
This is Dr. Stringham. Can anybody hear me?
Public comment.
You want to go back to that? Okay.
I think we're muted too.
Okay, we'll go back then. We'll go back to our public comment. I believe there was a couple others wanted to talk here. Go ahead, come on up.
Dr.
Yeah,
Stringham.
yeah, Commissioner, it's Dr. Stringham. I still had some things I wanted to share.
Dr. Stringham, can you project your voice? We're having a hard time hearing you.
Yes, how is this? Can you hear me better now?
Yes.
Okay. I want to talk about what I think is the best approach for us to take here in Humboldt County. I'm not sure if people are surprised to hear my viewpoints on masks, on the mandates. I absolutely support masks. I absolutely hope that everyone will make the decision to get vaccinated. But I thoroughly understand that it may not be the right decision for people. And if it's not, then I recommend that people do what they think is best for them. I think that we don't have to come together as a group in order to fight this virus. And what I think is that this virus is a group problem, but the virus can be fought at the individual level. And my feeling is everybody has the right to make their own minds up. I would love to see everybody wear a mask, and I'd love to see everybody get vaccinated, but I know that that's not going to happen. And I would rather, in the end, use the amount of influence that I have to help people to make the right decisions. And I don't think it's ever wise to force people to do things against their will. I have never once done that, and I never will. I'm not a person who forces people to do things against their will. I would say that it's my right to decide to be vaccinated and to wear a mask. And it's also my right to approach people who decide not to wear a mask with my own personal decisions. So somebody wants to use their freedoms from wearing a mask. I can use my freedom to not be in the same immediate surroundings as that person. And in that respect, we can each handle this in our own individual ways. I'd like to close by saying that that this is an individual choice. I think all of us on the health board understand that. And I also think that that we can do a great job of handling this if everybody makes the decisions that are appropriate for them. I do think if a person chooses not to be vaccinated and chooses not to wear a mask, that in the end, it's probably more likely that that person will get infected. But that's their choice, and that's how I feel about it. So I open the floor to other board members and to members of the public to determine what each of them would like to do and what's right for them. So sorry that everything's becoming so convoluted. I can't imagine what it's like to be a member of the public and to be subjected to all of these differing viewpoints. but I do think we'll get through this. So thank you very much, everyone.
Thank you, Dr. Stringham. Do any of the board members have a question, Dr. Stringham? I see none. Thank you, Dr. Stringham.
Thank you.
Okay, now we'll go back to public comment. Please state your name for the record.
My name is Kelly Anderson for the record. For one thing, for the record, Dr. Stringham is a part of the hospital and they are mandating vaccines for their employees. I am just nearly positive of that. So that's not an accurate, truthful statement. And I want to read this to, this is about the vax, not necessarily about the mask, but the legal status and of the current COVID vaccines, and aren't they still experimental? Can you please provide details and assurances that the vaccine has been fully and independently and rigorously tested against control groups and the subsequent outcomes of those tests? Can you please provide a full list of the contents of the vaccine I am to receive, and if any are toxic to the body? Can you please fully advise of all the adverse reactions associated with this vaccine since its introduction, including loss of ability to have children? Can you please confirm that the vaccine you're advocating is not experimental RNA gene altering therapy? Can you please confirm that I will not be under any duress from yourselves as my employers or in compliance with the Nuremberg Code? Can you please advise me of the likely risk of fatality should I be unfortunate enough to contract COVID-19, which is not even a thing anymore. There's no COVID-19 anymore. It's done. It's the new strain, and the likelihood of recovery. Once I have received the above information in full and am satisfied that there is no threat to my health, I will be happy to accept your offer to receive the treatment, but with certain conditions, namely that you will confirm that I will suffer no harm from receiving this vaccine. Number 2, following acceptance of this, the offer must be signed by a fully qualified doctor who will take full legal and financial responsibility for any injuries occurring to myself and or from any interactions by authorized personnel regarding these procedures. In the event I should have to decline the offer of vaccination, please confirm that it will not compromise my position in any company that I may work for, and that I will not suffer prejudice and discrimination as a result, especially with the implants that Bill Gates plans to use in the future to assure that we have the vaccine. I just wanted to tell you, make sure you're aware of these concerns and remind you that we do live in the United States of America. Thank you.
Thank you.
Hi, Michelle Miller for the record. I actually wanted to address something you said. I am on the hospital board. I'm the secretary. I've been there for a few years. I am one of the elected officials that has been fighting for no mandatory vaccines or testing at the hospital. After weeks of going back and forth.
Michelle, can you talk into the mic?
Yeah, after weeks of going back and forth with the CEO at the hospital, our CNO, Ken Tipton, other folks, I'd like to read you an email that came from the hospital, August 19th at 11:30 a.m. This email was sent to all employees and board members. There has been a lot of misinformed talk about the hospital requiring mandatory vaccines for employees and staff or mandatory testing for those not vaccinated. I want to dispel those rumors right now. The hospital will not require mandatory vaccines or testing for those not vaccinated unless we are directed or required by a federal agency. We do support continuing vigilance and safety during this time. Tim Powers, CEO. We will not be mandating vaccines, or testing.
Thank you, Michelle.
Thanks, Michelle.
Add that information up too.
Hi, Kat Hall for the record. I kind of just, I was going to say the same thing a little bit as Kelly did. If any doctor is that confident of the safety of these measures, including getting the vaccination, I would think it would be no problem to sign their personal guarantee that they would be legally and financially responsible for any adverse reactions, including death. I also believe that a lot of this money being spent to push how to protect yourself from the virus, which I think, to my understanding, is still less than 1% chance of death, instead of talking about wearing a mask and not seeing your family and friends, how about get some exercise, some sunshine, supplements would be a great idea. Vitamin C, zinc, all of these things that are easily accessible to the public, do not require a doctor's prescription or recommendation. And I think that would better suit the whole world, this community especially, instead of driving the fear of other people not wearing a mask or other people not being vaccinated. How can you protect yourself from the virus? So I really am disappointed that there's not more of that push on teaching people how to really protect themselves from this. Thank you.
Thank you.
My name's Deborah Gay, and I just have one more quick thing to say. There are other protocols out there that help the virus before it begins. And I know the government and CISILAC and many people have buried it and will not let it come out. They've actually banned them. Hydrochloroquine, ivermectin, budesonide, that if taken early can stop it from getting bad. You go to a hospital, what do they tell you? Go home. If it gets really bad and you can't breathe, come back. We'll put you on a ventilator and kill you. That's what they're doing. Many hospitals are out there doing that. They're sending people home until they're sick enough to come back. Instead of giving them the hydrochloroquine, the ivermectin, the budesonide, if they would put them on high doses of vitamin C, D, zinc, high doses, liquid high doses in the hospital right when they stepped in the door, that would bring down the COVID. They would go home in 2 to 3 days instead of waiting until they're dying before they get fixed. Thank you.
Thank you.
John Laird for the record.
Speak into the, right up
Yep.
the microphone.
John Laird for the record. Just wanted to take a second to say thank you to our Board of Commissioners. I know that you're in a tight spot right now, and I believe that you want what's best for the folks of this community. I know that's not always an easy decision to make, and the people that showed up today, I just wanted to say thanks for speaking up. I wanted to piggyback just a little bit on what Lisa had talked about a few minutes ago. The fact that we have 30 or so people in this room speaking for the entire community doesn't help you make good decisions, I don't think. So my thoughts in listening today, this is the second time I've taken off work. I came to a commissioners meeting here a few weeks ago, and you know, the first thing we should do to solve the dilemma that we have going on right now is to make it as easy as possible for the folks of our community to let you know how they feel about the decisions you're making. So, you know, we won't solve the COVID crisis today, more than likely, but a step in the right direction, in my opinion, would be that we go out of our way to get people together to voice their opinion, so that when you guys push forward with some of these directions, you can do it with confidence and know that you are doing what people want you to do. That's it.
Thank you, John. Anyone else? Come on up.
My name is Kim Christofferson. I just wanted to let you know from what I've been seeing in this last year, a whole country division. Since the shutdown, I was not a necessary employee, so I sat home. I made masks to help the community. I listened to my phone probably like 10 hours a day, watching the WHO, watching the CDC, watching the White House, listening to Fauci, listening to Dr. Birx, and then listening to the governor to find out what our state regulations will be. One thing I found was that they were inconsistent. What the WHO was saying is not as strict as what the CDC was saying. I watched the White House and then I watched the news. The news distorted the information and lied to the people. We have a virus every year. 15 years ago, I came down with pneumonia. There was no state, country shut down because there was a virus out there. I got sick, I had pneumonia, medication took care of it. Now, why is it all of a sudden that there is this one virus and we all have to jump through hoops and listen to what this Dr. Fauci is telling the people to do? We are following his guidelines, the same doctor who, I think it's all out there now in the emails that he is behind creating this virus. I wanted to submit for the record for everybody to read a little letter here from Michael Anderson. He was a state mine inspector and is currently a mine safety coordinator. He has to follow OSHA guidelines. He cannot mandate his employees to wear a mask because there's only a splash guard. Unless N95s are administered and fit tested, that is only protecting you from inhaling the particles, not exhaling. So if we're wearing cloth masks, that's just like saying it's you're blocking a fart. Okay, I'm sure that's been all over the memes and everything, but this is dividing our country. If people, we do have a virus. I'm not arguing that. We have a virus every year. And if they want to push the vaccination, and the vaccination is for what, the COVID-19. Now we have a new variant. Are those vaccinations altered for this new variant? Does it change our DNA? Does it change our immune system? One more thing. From what I understand, I'm not going to quote anybody. I'm not going to go against any officials. But I did get notification probably back in March or so from the news. I get all these apps. They send me notifications, KOLO, whatever, CNN, blah, blah, blah. It was reported that there were no influenza deaths in 2020. Every fall, we get an influenza shot, right, to help with the influenza for the following winter. That following winter, we didn't have any influenza deaths. It was all lumped into COVID. I would also like to say that why are they not pushing the use of vitamins to help our immune system instead of wearing masks that compromise our immune system? Thank you.
Thank you.
Can I submit this?
Yeah, I'll take over. Thank you.
Would anyone else like to make a public comment? Do we have anyone online that would like to make a public comment? You will have to unmute yourself, which is *6. And please identify yourself if you'd like to make a public comment at this time.
Hi, this is Lindsay Jimenez. I'm calling in. Can you hear me?
Yes. Yep.
Hi. First and foremost, thanks for taking the time out to listen to us all, and we appreciate that for our community. A few things. I guess the one thing I would like to that I always think of when we are dealing with something like this is I feel like our poor community honestly has lost a lot of people due to mental health and suicides last year and a half, 2 years, and we are more concerned about fighting, mask mandates and stuff like that than letting people just make the best choice for themselves and their family, and it's causing chaos in other ways. I would just like to see that we could all make, our best choices, stay home when you're sick. It would be nice if we could hear, other things that are options. A vaccine isn't an option for everybody. We don't have good data to support it. And people saying that there is good data. Data is, we haven't even had 10 years, let alone 20 years to see what this is going to come out to be. So I think that to have other options, healthy medications, not necessarily like lining the pockets of pharmaceuticals. There's beneficial vitamins and sleep and exercise and just working on good general health and well-being of people would be nice to be addressed amongst everything else. I don't think that just a mask and a vaccine is an answer for everybody. I think that we could harm more people than good at one point, because we don't know, if somebody has diabetes, how is that vaccine going to affect them? If somebody, has a heart condition, what's going to come down the pike? I definitely don't believe that we should be practicing this on our 12-year-olds. I think that, 12 and above or whatever, I'd like to hear our community work on, just building good immunity and just back to an overall good well-being for us. So that's all I'd like to say.
Thank you.
Thank you.
Anyone else would like to comment? *6 to unmute yourself and identify yourself for the public record. See anybody?
I see nobody's got their hand up.
Okay, we will end public comment at this time, and we will move on to go to the update from the Public Information Officer. Nicole, are you
I
on?
can hear it here, but how do you put it on speaker? Oh.
I am. Can you hear me okay?
We can hear you. Yes, please.
All right. Good morning. Thanks. I'll just give us a quick update, snapshot of where we're at right now with our numbers. As of last Friday, I get numbers around 4 to 5 p.m. So as of last Friday, which are the latest numbers I have, we have 1,352 total, 1,273 recovered, and 65 active cases. As you know, on Friday, our numbers kind of tipped over the edge as far as the state. So we are now officially flagged. Our testing numbers have gone up a little bit over the last several weeks. So our latest numbers are 141 testing a week. That's an average. 258 case count. So as you know, they base that on 100,000 average. And then our test positivity rate is up 2 points from 6.9% last week to 8.9%. Just keep in mind that 8.9% does not count last Friday's numbers. Just to give you a quick idea, so right now we have 96 cases for August. That's August 1st through the 20th. That's 4.8 cases per day. Obviously, those are just the people being tested. We know that we have people testing through the Fort McDermott Wellness Center. We don't get that data. And we also have people who choose not to be tested. Hopefully are being careful and staying at home, and so we don't have that data as well. But our last high count was in January of this past year. We had 200 cases in January, 6.5 cases a day. We came down in February and March, blipped a little bit in April, up to 77 cases per day. And then this is our high since January for the year. 32% of Humboldt County is fully vaccinated against the virus, just to give you an idea, to put us in perspective. 46% of Nevada is fully vaccinated and 51% nationally. 43% of our population 12 and older has initiated vaccination. So again, the vaccine is only available for people 12 and older. Some interesting good news for people who are immunocompromised this week. They can now receive a third dose of the Pfizer or Moderna vaccines, and we have not gotten the green light yet from the state to begin that process. Marcia Foreman with Community Health said that will be a bit of a vetting process, and when she has that information, we'll share that with the community for anybody who would like to participate in that. Marcia has announced the annual drive-through flu pod. So again, this is the flu vaccine, not the COVID vaccine. That's 4 to 8 p.m. on Wednesday, September 29th. It appears that she has 800 vaccines that are available. And 5 local people are currently hospitalized with COVID. One of the hospitalized is intubated, and I just want to turn the rest of my time over to Robin Dunkhorst. She's the Chief Nursing Officer at the hospital. She's going to share just a little bit on where the hospital is at right now. Robin, are you on?
Hey, can everybody hear me?
Yes, we can.
Yes.
Hi, good morning. I simply wanted to just provide you with a little bit of information, and obviously not my opinion. So our biggest concern at Humboldt General is the healthcare resources, becoming a problem. One of the number one reasons is because us being a critical access hospital with lack of specialty support providers and that kind of thing, we send a big chunk of our higher level of care patients to tertiary centers, which would be Renown, Carson Tahoe, St. Mary's, Northern Nevada, St. Al, St. Luke's, University of Utah, as well as University Medical Center in Vegas. Throughout the last 2 weeks, we've been experiencing significant problems with getting any patient out. I'm not referring to just simply COVID. With people that are having a heart attack. We've had problems with people having neurologic issues. It comes and goes, so I don't want to paint an alarmist picture that we can't get anybody out. But they come off and on of divert status at these, every few hours. They'll loosen up their bed count, and rural hospitals are able to potentially squeeze a patient in that way. Major trauma centers still have to accept major trauma as well as large vessel injury or large vessel damage problems. They are not allowed to divert those, so we haven't had a lot of issues with that. With our increase in hospitalized COVID cases, we're considering, how we're going to manage a surge plan should we continue to have increased admissions. That obviously depletes our internal hospital resources. Those are some of our biggest major concerns when it comes to COVID, as well as non-COVID, because of not being able to get our patients to a higher level of care as quickly as we have in the past. So I wanted the board to know that information. And if you have any questions, I'm willing to answer what I can.
Does anyone have questions, Robin? I think I heard the question. The question was, Robin, is how many people that have been admitted to the hospital with COVID have been vaccinated?
We've had one admitted of our, I'd have to get the proper data because patients come in and out of the hospital. Obviously with COVID, we currently have 5 with one of those in the ICU, and none of them are vaccinated. mean, I'd have to get the board the accurate data from the patients that have been admitted and discharged. I don't have the exact number.
Robin, I can help answer that if that helps. This is Nicole Maher.
Yes, thank you.
You betcha. I get that information through the state. That was something that Dr. Stringham and I specifically asked for, so that we could check that for every patient, not just people who are hospitalized, but also people who actually are confirming for the virus. We just had our very first breakthrough case last week. It was a person who was vaccinated with the Johnson & Johnson vaccine. It still counts as a breakthrough case, even though it's considered 66% efficacy, as opposed to the Pfizer and Moderna, but still our very first breakthrough case.
Any other questions?
Yes, we do have one. I'm trying to get it for you.
Okay.
They run the COVID test to see if you have COVID. What resolution are they running those at? They run 25% and 20 resolutions, 25 resolutions, 40 resolutions. What resolutions are they running at?
The question is, what resolutions are you running the COVID test at?
I'm not sure what, I'm not a microbiologist or a lab tech. I'm just the chief nursing officer, so I'm not sure how to answer that question.
Okay, thank you. Michelle?
I just want to come up, I'll speak into the mic so everyone can hear. I just want to tell everyone that some of the questions regarding the hospital tomorrow night at 5:30, they're only holding it via Zoom. I will get into that tomorrow. Y'all should come. Come to a public comment. Come ask your questions of the hospital. Come let your voices be heard. It's really important. I'll be honest with you. At the hospital board meetings, I mean, Ashley and Ken can attest, we're lucky if we have one person that ever attends. And I would love to have people's questions answered. I'd love to hear your opinions at that board with the folks there that are making these decisions. So just want to put that out there.
Thanks. Mr. Chair, on the line, I have Marcia Foreman, our community health nurse. Go ahead, Marcia.
Go ahead, Marcia.
Yes, Robin, could you tell me, I have a lot of people who ask on the drive-through testing, is it a PCR or a rapid that they're performing?
It's the Binax now. It's not the PCR.
Okay, and then if they are positive, is it being followed up with a PCR?
That's on the individual to determine if they would like it sent out. Because it's costly, it has a cost attached to it.
Okay, thank you. I just have a lot of people asking.
You're welcome.
Any other questions?
Yeah, one person is being positive for COVID or variant in a household. Is the entire household considered positive now? Or counted as positive?
I think that would be a question for Dr. Stringham. Are you still on, Dr. Stringham? I'm not positive about it, sir, but I believe that if one person tests positive within a family and the rest of the family is asked to quarantine, they're not put down as positive unless they are tested. I've heard those things too. I can't answer those. Any other questions?
I just want to explain to you why I asked about the resolutions, because the resolutions, they run those tests on. If they run them at a high resolution, you could have you could go out and stiff pepper and have a runny nose and it will come back COVID positive because it's ran at such a high resolution that it makes the test positive. If it's ran at a correct resolution, it will show whether you do or do not have COVID. That's why I asked that question. And most of them are running them at 42 resolutions, and they should be being run between 25 and 30.
Yeah, I think she said that she wasn't able to answer your question there.
Commissioner Tipton, this is Nicole Maher.
Go ahead, Nicole.
I couldn't quite make out what the question was before. I'm sorry, this meeting is cutting in and out, but if I'm correct, was the person asking?
More, Nicole.
Sure, let me see if I can speak up. I couldn't quite make out what the person was asking, not this particular question right now, but the one before where they were asking about a family. If one person tested positive, were the other ones also considered positive? Was that correct, the question?
Correct.
Okay. I can just say for Humboldt County, we have never, ever counted a presumed positive. That's never happened in our county. So if I actually release a case, it means that I have actually received a confirmed test indicating that that person is positive. As far as a family situation, the contact tracers are in contact, obviously, with a person who receives a confirmed positive, and they can help identify if other family members need to get tested, but we would never count a positive unless the other family members were tested. Does that answer that question? Did I understand that correctly?
Okay. All right, thank you. Any other questions?
This question is for Nicole Maher. I was just wondering if you are offering all 3 of the vaccinations. And go ahead.
Yes, thank you. Yes, we offer all 3, although I can't speak for, so the 3 places where you can get vaccinated in our county are through Walmart's pharmacy, Ridley's pharmacy, or through Community Health. And if Marcia, if you're still on the line, perhaps you can answer this better than me. I know that Ridley's and Walmart have told us that it just depends on what vaccines are coming through to them, and that was my understanding with Community Health as well. So sometimes we might have more of one vaccine versus another, and so they give what's available. Obviously, for the youth, the only available vaccine is Pfizer.
Okay, and so the efficacy of each vaccine is not equal. Is that correct?
That's correct. So the Johnson & Johnson, the efficacy is about 66%, and the Moderna is about 94 to 95%, and the Pfizer is about 95%. So there's going to be a little bit of a wiggle room in there.
So are you encouraging the vaccine on people with previous COVID positive recoveries?
So people are considered vulnerable once again after 90 days. So just to give you an idea, I'll just give you this quick background that might help. So if somebody tests positive a second time for COVID and it's under 90 days, we do not count that as a second case. But if they test positive after 90 days, the information that they have indicates that after somebody has COVID, their antibodies are active for 90 days. And after that, it's considered a new case, as in a second case. And so, yes, we absolutely ask people to get vaccinated so as to protect them from a second or a third case.
Do the vaccinations improve the immune system?
I can't answer that. That would be a question for Dr. Stringham or a healthcare provider.
Okay.
This
thank you.
is Marcia, the community health nurse. I was wondering if I can help with any of those questions. First
ahead.
of all, you know, I may not be the most popular person in the room right now, but we have vaccines. We have Moderna, we have Johnson & Johnson, and we have Pfizer. So those that do want vaccines can call and make an appointment. Pfizer is 12 and above. Moderna is 18 and above. Johnson & Johnson is 18 and above. Both Pfizer and Moderna have a 95% efficiency, and Johnson & Johnson is, as Nicole said, 66%. We will be starting also with the immunosuppressed, and that is 28 days after your last vaccine. But those are for those with HIV, organ transplants, on cancer treatment, those type of things. For the regular Joe who has gotten their COVID vaccine and wants the third vaccine, it is 8 months after your second vaccine. So those things are available. I'm just letting you know we have those at the community health clinic. And also, it does not give you any extra immune anything. It is just like any other vaccine. It gives you a chance for it, fools your body into thinking that it has that COVID or that measles, mumps, rubella, whatever. And so your body builds up all these antibodies to protect against that virus getting in. Just like with the normal flu vaccine that we get every year. It fools your body. You may get the flu, but you probably aren't going to get it as seriously as normal. So there's always those risks and benefits to any vaccine. It has to be a completely personal choice. And on a side note, we are having the seasonal flu vaccine, the drive-through, on September 29th from 4 to 8. And just because everyone thinks there is not the seasonal flu, there is the seasonal flu. We did everything right last year. We wore masks. We didn't breathe on each other. We didn't touch things. We wiped things down. We washed our hands. You know, so just so that it's out there. And if there's any questions I can answer, feel free, go for it.
You come on up and speak into the microphone and she'll be able to hear your question.
My name's Deborah Gay, and I had a quick question for you. Do you have the inserts of those Pfizer, Moderna, the information that tells you what's physically in the actual vaccine? Can you pull one of those out?
I can pull one of those out and I can tell you they're completely blank.
Okay, that's what I wanted to physically know, that they're physically blank so nobody knows what's in them, correct?
No, if you go on their websites, it will show you exactly what's in them. But that is physically blank. I'm not going to hold any information back. Each one of those are physically blank because they are not FDA approved except for an emergency use.
Pfizer just got approved, so you should be getting those in those packets from here on out. That since Pfizer's been approved, I would love to get a hold of one of those because I want to know if they have the graphene oxide in them.
Okay, you can go on the Pfizer website and it will show exactly what's in those vaccines, or you can, you know, keep checking in my office. I only order enough vaccines so that we have what is needed in the community so that we don't lose any stock. And so, you know, I don't know when we'll be getting new stock in as it's needed for those new pamphlets.
Any other questions?
How many dedicated?
Are you still on, Robin?
I am.
Okay.
How many beds does the hospital have, dedicated beds for COVID patients?
We have 7 reverse isolation beds set up on med-surg, between the med-surg and the ICU unit. We have 2 in the emergency room. We have one in the OB unit. We also have one in the PACU pre-op area.
Okay,
We
thank
can
you.
we can also put up the disaster tent. Obviously, we do have capability. The problem is staffing. That's one of the bigger parts of the tertiary centers, the higher level of care hospitals, is staffing. Because we're staffed to the bed capacity we're capable of handling currently, not major overflow. So that's the biggest problem with, I think, even in the Reno area, is their staffing problem.
Okay, thank you.
Come on up.
I have a question for a hospital official. What is the protocol when a positive case presents?
I believe that would be a question which should be asked at tomorrow night's meeting at the hospital. It's a Zoom meeting, you'll be able to get on it.
Okay. I would just like to ask all of you guys to please consider that the community needs their freedom. We don't want to be mandated.
Thank you.
Vaccines or masks.
Any other questions for Nicole or Robin or Marcia? No? Okay, thank you. Thank you, Robin, Nicole, Marcia. We'll move on now to the next item on the agenda, which is discussion of mandatory mask mandate directive. Consideration, discussion, and possible action regarding a response to Humboldt County being listed as a COVID high-risk county by the state's Mitigation and Management Task Force, and discussion regarding the state's mandatory mask mandate for high-risk counties. Discussion and possible action. We'll go to you first, Sheriff. Your thoughts on this?
Well, I think is what our job is up here, is to get most of the, get the information, educate ourselves, and do what's best for ourselves and for our community and for our family, for our businesses. I'll put it out there right now, Dr. Stringham's comment about we're not in a position to enforce a mask mandate. I think this is an individual responsibility or choice, I guess would be a better word, an individual choice on the people. But all I can do is speak for myself. I think businesses have the right to mandate what they want themselves. So with that, I just think it's an individual choice, and that's people know their body, they know what they're susceptible to, and I just think it's an individual choice.
Thank you, Sheriff. Commissioner Cherry.
Well, I have a lot to say, but I'm going to boil it down because I think most of it's been said. If I wasn't a commissioner, I'd probably be sitting out there with the rest of you because I feel much the same way you do about this. This is a virus. It's going to be here forever. We cannot shut this country down every time a new variant, and this isn't going to be the first or the last variant. I am discouraged, saddened by how this one thing has divided this country, along with a lot of other things. It's the news, even our government makes many of us feel like bad people because we won't wear a mask. We have two classes of citizens because of this. In a country where we're always hearing about prejudice and treat everybody the same, they're doing just the opposite here and making it worse every day. I don't want to be part of that, so I would never vote to be in favor of masking. We've done that. Most of us have taken, or something, I'm not going to say most of us, some of us have taken shots like we were asked to. We wore masks last year like we were asked to, all thinking that it would be over, and it'll never be over if we don't finally say enough is enough. I am saddened by what it's doing to our adolescents, our youth. They're not able to live freely to experience what most of us experienced as young adults, as children. And it's not fair. And at some point, we as, I guess, leaders, government, need to take a stand. And I am not in favor of masking. I'll just say that. And nor am I in favor of limiting gatherings. We've got to get this country back to where we used to be. And the only way to do that is to do that, not to keep going backwards.
Thank you, Commissioner. Commissioner Haas.
First of all, thank you, all of you, for being here. I do not believe that wearing a mask is going to help with this virus. And I do believe that we have an individual choice on everything we do. We still have the Constitution, although they're trying to take it away from us, but you still have the choice of taking vaccines, whether it be for the coronavirus, whether it be for flu. You have a choice of wearing a mask. Please don't punish any of the businesses. If they decide that they would like to have you wear a mask when you come into my business, you know, if you want to go in there, but honor that and don't fight with them over the thing. If you don't believe in what they believe in, if you don't want to wear that mask, it's simple, just don't go there. Thank you.
Thank you, Commissioner Haas. Commissioner Hill.
Yeah, this is Commissioner Hill. Yeah, thanks everybody for showing up. It does mean a lot to us to have you guys here and hearing from both sides. It really does help make our job a lot easier up here. Kind of sometimes feel like you're on a pedestal up here trying to make decisions for the whole county. But like has been said before, you know, all we can do is go with our gut and go with what we hear and what we know of. Like Dr. Stringham said, there's so much convoluted information out there. I'm going to go on record right now. I don't believe a damn thing the federal government says right now or the state government. It's just so convoluted. But what I can control is our local government. So I'm a part of the local government. So, you know, that's what we can manage right now. And as far as I'm concerned, there's pros and cons to all of it. There's pros and cons to the vaccine. There's pros and cons to the masks. But it does boil down to a personal choice and a personal choice of freedom. Do what you're comfortable with as a business, as a person. Don't shame somebody for not wearing a mask. Don't shame somebody for wearing a mask. Same with the vaccine. Don't shame somebody for taking it. It's a personal choice. If my wife wants to take it, so be it. She can take it. If I don't want to take it, or if I want to take it, it's all a personal choice. And that's where I stand.
Thank you, Commissioner Hill. I feel much the same way as the rest of the commissioners do. I would like to thank all of you for showing up and voicing your opinions. It helps on any issue. We like to hear what the public has to say. I really am sad about the way these mask mandates have torn this country apart, along with some of the other things. And I'm ashamed of our mainstream media news that they refuse to report both sides of the issues and let us make up our minds by what we hear. And they've made it so that we don't trust that now. We don't trust what we see on the news so often because we know there's another side that we don't get to hear about. And I would say that my position is that we go forward, and I think the most important thing is, you know, to wash your hands and to try to avoid tight situations, especially if you're worried about getting the virus. You know, get that separation. I think that's helped a lot of us stay safe. And my big concern over it is the hospital and the way the incidents are piling up in the last 2 to 3 weeks, and they really have. There's no denying that, and I worry about the hospital being full and one of us needing it for a heart attack or some other reason. And there may not be that room available, and we have to be shipped out where we could be treated right here locally. I'm certainly not in favor of any mandates. I think it divides our country. I don't think it helps with the virus. Those that do feel that way, I'm more than happy to, to sit down and visit with them, and I don't condemn them for wanting to wear a mask. And I certainly feel like it's my responsibility to wear a mask if I go into a business that asks me to wear one. Only takes me a few minutes. I put the mask on, I take it off when I'm done buying what I want to buy, and I'm out of there. If they don't mandate the mask, I'm probably not going to wear one. So at this time, is there anybody that would like to make some sort of a motion?
I just want to make one more statement. I don't know if I was clear this, Commissioner Hill. My position is against the mandate or against any more businesses shutting down again. As I stated before, do what you feel is right, but I'm not for shutting down any businesses, not for mandating a vaccine or mandating any masks. Just wanted to make that clear on the record.
And if anyone would like to make a motion here, this is a motion from the health board to direct the commission.
I would be prepared to make a motion. This is Commissioner Hill. I would make a motion that we direct all of our offices and or agents to refuse to enforce any of the governor's mask mandates that are in place right now. It would go along with our resolution that was put in place last February, I believe.
Wendy?
Wendy Maddox, for purpose of the record. Would you amend your motion to make that a recommendation to the Board of Commissioners?
I would amend that motion to make it a recommendation to the Board of Commissioners.
Okay, we have a motion on the floor. Are there any questions on the motion? Hearing none, all in favor signify by saying aye.
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 Motion passes unanimous. Next item on the agenda is discussion regarding large gatherings in Humboldt County. Consideration, discussion, and possible action regarding large gatherings in Humboldt County with the emergence of the Delta variant. Discussion and possible action. This was brought up several times, I think, and I thought Commissioner Cherry did a good job of laying that out. The large gatherings, and we have some of them coming up. We've had some in the last couple of weeks, but there again, that's personal choice. If we have a Humboldt County fair and you don't want to be exposed, you're afraid of being exposed at a gathering like that, don't go. So it's a personal choice, and I think we need to continue having our gatherings and doing our business as usual. And if you have a health concern, if you're immunocompromised, then you should do what you feel is safe for you, and the rest of us should be able to enjoy our lives. So, Sheriff, again, I'll start with you.
I would agree with you that once again, it's an individual choice whether a person or not wants to attend these public gatherings. I do understand that a lot of these social gatherings is where a lot of the virus is spread, but those people have the choice whether to go there or not. And I think it's an individual choice.
Commissioner Cherry?
Yeah, and I'll just kind of echo that same thing, and you can go to these large gatherings, and if you're concerned, wear a mask. So, yeah.
Well, yes, I heard that. Yeah, wash your hands, and if you're sick, don't go. You know. Commissioner Haas.
I can reiterate the whole thing that they've said already. You know, it's personal choice. If you want to wash your hands, wash your hands. If you don't. You know, it's been recommended to us that by washing your hands and keeping yourself away from different viruses and whatnot, it'll help. And that's been proven. You know, you have the large gatherings. If you want to go, go. If you want to wear a mask, wear a mask. Use their sanitation. Use it everything, you know, everything else that's available to us. Now they're saying that our smaller gatherings, usually with family and different stuff, is spreading the virus even more. Again, that can be taken care of among yourselves. I mean, you don't have to get right in somebody's face to talk to them. Stay away from them and talk to them. But just use the sanitary procedures that we've been taught, and, it's going to help us.
Thank you, Commissioner Haas. Commissioner Hill.
Yeah, this Commissioner Hill. Again, the virus is out there. We all know about it. We've heard about it for 2 years now, or going on a year and a half. Protect yourself how you see fit. We can't shut down these gatherings. We can't shut down our county again for all this. It'll never end. We got to roll on, I guess, is how they say. So again, I would not be in favor of shutting down any of our large gatherings. Take personal responsibility. We don't need the government to tell us how to protect ourselves in our homes and in large gatherings. Do what you feel right with. Look inside yourself and do what's right for yourself and for the people around you. That's it.
Thank you, Commissioner Hill. Any other questions? I'd entertain a motion for recommendation for the Humboldt County Board of Commissioners at this time.
Roll.
Okay, this is Commissioner Hill. I would make a motion again to make a recommendation to the county commissioners to direct all offices and agents to refuse to enforce the governor's mask mandates along with any large gathering restrictions or mandates.
Okay, thank you. We have a motion on the floor. Any questions on the motion? Hearing none, signify by saying aye.
Aye.
Thank you. Motion passes. Unanimous. Next item is approval of minutes. We have a lot of minutes to approve here. We'll go first to June 11th, 2020.
I'll make a motion to approve the minutes for, you have June 11th?
June 11th, 2020.
Okay.
This is Wendy Maddox, purpose of the record. I think it's appropriate if you want to list them all out in one motion.
Okay.
For you to do it that way, unless you need to break them up, but it's completely up to you.
Then.
So I'll ask for a motion for all of them then, and then before we vote on it, I'll let each one of them abstain from those dates that they want.
Sounds good.
Okay. Make a motion again.
I'll make a motion to approve all of the minutes presented as presented.
Okay. Do you
want me? You don't need to read each date, do I?
No.
Okay.
Okay, we have a motion on the floor to approve the minutes that have been presented as presented. I will be abstaining from the October 29th, 2020 minutes. Commissioner Cherry, are there any you will abstain from?
Yes, I will be abstaining from the October 29th, 2020 minutes, the December 17th, 2020 minutes, December 23rd, 2020 minutes, and the June 25th to 2020 meeting minutes.
Sheriff?
You know what? I'll have to be honest, and I didn't have an opportunity to review the dates when I would have been here or not.
Okay, thank you. Commissioner Haas?
I'm going to abstain for any of the 2020s.
Okay.
This is Commissioner Hill. I'm going to abstain from all the 2020s myself.
Okay.
I'm in the same boat.
That would be appropriate. And I also want to make everybody aware for purposes of if we don't have enough people for the minutes to be approved, I think it's important to note the distinction, to note that you weren't present, but you can always approve the minutes even if you weren't there, if they're in proper form and substance as minutes usually are.
Okay.
Okay.
All right, we have a motion on the floor. Any questions on the motion?
So are they abstaining from 2020 then, or do they need to restate if they choose to vote?
If you choose to vote on those as to form and substance that they're in, then you may, you're not prevented from that so that they get approved, but it's up to you.
All right, this Commissioner Hill, I want to retract that. I will vote on all minutes that I was available and at the meeting for.
That you were unavailable and not at the meeting for?
Yeah, yeah.
As to being in proper form? Okay,
And then it has to be in proper form.
sounds good.
Did I mess y'all up, Tammy? You're good. Okay. Thanks.
Are you continuing to abstain then?
I would still like to abstain from 2020.
Okay,
No.
we have a motion on the floor. Any questions on the motion?
Just real quick, I'll abstain from the ones I was not present.
Okay, thank you. All in favor signify by aye.
Aye.
Aye. Motion passes. Any public comment? Any public comment online? You'll have to star 6 to unmute yourself if you have a public comment. Hearing no public comment, this.
Mr. Chair, there is future agenda items on there as well. And I guess I would just recommend that unless you have something specific, that we not do anything at this point in time. If something comes up, we can reassemble for a health board meeting at that time, unless you have something specific that.
I guess, this Commissioner Hill, I have a question. I wonder if with the popularity of the health board and the rising of the COVID, if we shouldn't plan on starting to have a separate day for health board meetings again? Or at least look at it. I'm not making a recommendation or a.
I would agree with Commissioner Hill, but with also with what the county manager is saying is to only have the meetings if necessary.
Yeah, for sure. I don't know. We're doing pretty good, but it's going to make a pretty long day, which I'll stay all night if I have to, I guess.
Stay all night.
So you wanted a different day?
Yeah.
Well, I'm just wondering if they're going to be a couple hour meetings, you know, going forward for the next however long, if we shouldn't schedule them on a separate day. I'm just asking, I guess.
I think,
I'm good with having it here too.
I think today's was to be expected. It might
Yeah.
be long, but unless we have something like that come up again, we
Okay.
could do it keep it a separate day.
Yeah, I'm good either way. I just.
And if we do,
Throwing it
we
up.
can go back to the Thursday rotation too. So that way we don't
I
run
don't
into
know.
stacking them.
Sometimes it's nice to put it all in one day too and do all your business on one day. For me, it's.
Prior to this, though, having that update in the commission meetings has worked fairly well.
Yep.
You know, I think so.
Yeah.
Can continue to do that. I would
Okay.
say.
Sure.
Okay,
I've changed my mind. Let's just keep them.
so we'll leave it as is for right now.
Let's
and,
leave it to what to put on the agenda.
If we see a need, then we can go ahead and add to it at another date. We'll have to have another meeting somewhere in the future because Tammy will have more minutes for us
Right.
to approve. So. Okay, anything else? Future agenda items? There's no public comment. This meeting is adjourned.
Can we take 5?
Yes, we're going to take 5 minutes, then come back and call the county commission meeting to order, but